Wikidontist.com. Truth about tooth.
Hi, I am Dr. Thomas Nechupadam, and today we are going to talk about the orthodontic retainer or what is called as a removable appliance or a removable orthodontic appliance. Most of the people want to reduce the cost by just using a removable appliance and try to move the teeth with removable appliances. It used to be a very good idea, but to get a large amount of tooth movement, it is not possible with removable appliance. First of all, let me tell you that. Second thing is the retainer, it is actually used as a retainer after orthodontic treatment, but you need to use it properly. So we are going to talk about the orthodontic retainer per se and how it should be used and how what are the limitations of orthodontic retainers. See, if there is a small space between your teeth and then you want to close it, we can still use you can adjust the retainer to be an active appliance and close the space. The small spaces can be closed with the retainers. That used to be the appliance of the past before the orthodontic appliances came. So there are removable appliances that can be adjusted, and then we can use it for minor orthodontic changes. But basically it is basically a retainer. What is a retainer? Retainer is a appliance which is given after the orthodontic treatment is done to hold the tooth in that position so that the bone may form. It's just like after your fracture of tooth, fracture of your hand, what happens is they put a plaster around your hand so that the bone heals well. That is actually holding the bone in that position. It doesn't have any active force on it, but it is passively holding there. So orthodontic retainer is also something like that, which is a passive appliance which holds the tooth in that position for some time. It can be adjusted to do minor teeth movements, but it cannot be used for large tooth movements. That's the reality of the scene. But most of the people call me and ask me, can we do correction of proclination, correction of jaw movements and all those things with retainers? No, it is not possible, because it can do only minor movements, it cannot do large movements. Do we need to adjust the retainers? Yes, you need to go for a review. You may not need to adjust the retainer much. If it has lost the elasticity, we can just adjust it. Otherwise, it is not required to adjust the retainer. How to keep it clean? You have to brush the retainer twice daily. When you are brushing, brush the retainer and keep it clean. That will make the retainer clean. Don't use hot water to clean the retainer at all, because hot water can distort the retainer. What are the types of retainers? The normal retainer, which is having a single metal wire, is the most commonly used. There are other retainers like permanent retainers, which is actually fixed onto the tooth. There are other retainers like clear retainers, which is actually an S6 retainer, which is clear in shape. But see, all these things have its own advantages and disadvantages. Permanent retainers can actually accumulate a lot of food and calculus in that area. The S6 retainers can actually break or even discolor later. The most commonly used and most widely used is the removable retainer with single wire, or commonly called as the single clip. It can move a little bit of tooth here and there. It can be adjusted, and it is very comfortable to use if it is used properly. How much time it has to be used? Most of the time the orthodontist tells you to use it for 6 months as permanent this thing, or use it for 20 to 21 hours, and after that use it during the night as a night guard or a night retainer. So once you use that, the bone will form around your tooth, and once bone forms around the tooth will stay in that position for quite some time. That is why we give you a retainer. So please understand that retainers are retainers, or the things that will keep the tooth in that position or retain the position of the tooth. It is not an active appliance most of the time. We can use it as an active appliance in its own limitations, but it cannot be used for large amounts of tooth movements. It needs fixed orthodontics or putting of brackets to move teeth in a very large movements. So thank you very much for watching. I am Dr. Thomas Nechupadam. If you like the video, please share it to all your friends. Thank you very much.
Wikidontist.com. Truth about tooth.